Hello friends, welcome all of you on my YouTube channel here, Anand's Nursing File. Today in this video we'll learn about the nursing care plan on chronic renal failure or end stage renal disease ESRD or chronic kidney disease. This is very important nursing care plan on uh, useful for the practical file work purpose or for examination purpose. तो आइए देखते हैं एनसीपी ऑन ईएसआरडी और क्रॉनिक रीनल फेलियर। नर्सिंग केयर प्लान से पहले हम यहाँ पर क्रॉनिक रीनल फेलियर या क्रॉनिक किडनी फेलियर या एंड स्टेज ऑफ रीनल डिजीज़ के बारे में यहाँ थोड़ा इंट्रोडक्शन देखते हैं क्या है। क्रॉनिक किडनी डिजीज ऑल्सो कॉल्ड क्रॉनिक किडनी फेलियर। Chronic renal failure is the end stage of gradual progressive loss of kidney functions, means end stage of renal disease. The final stage of chronic kidney disease is called end stage of renal disease. At this stage, the kidney are no longer able to remove enough waste and excess fluid from the body. At this point, you will need to dialysis or a kidney transplantation. तो यहाँ पर क्रॉनिक किडनी डिजीज़ और क्रॉनिक किडनी फेलियर या क्रॉनिक रीनल फेलियर या एंड स्टेज ऑफ रीनल डिजीज़ सेम थिंग्स है। यहाँ पर इनका केयर प्लान मीन्स कोई भी केयर प्लान पूछा जाए मीन्स ईएसआरडी का केयर प्लान या क्रॉनिक किडनी डिजीज़ का केयर प्लान, क्रॉनिक किडनी फेलियर का केयर प्लान या क्रॉनिक रीनल फेलियर का केयर प्लान, तो यहाँ पर हमको ये सेम केयर प्लान प्रिपेयर करना है, तैयार करना है। Next, the defining characteristics means sign and symptoms of chronic kidney disease: here nausea, vomiting, loss of appetite, fatigue, weakness, sleep problem, urinating more or less, here decreased mental sharpness, muscle cramps, swelling of the feet and ankle, dry skin, high blood pressure, hypertension that difficult to control, shortness of breath, if fluid builds up in the lungs, chest pain in the fluid build up around the lining of the heart. These are the defining characteristics or sign symptom of this disease. Next, our main topic here. देखते हैं हमारा जो आज का हमारा मुख्य टॉपिक ये है, नर्सिंग केयर प्लान ऑन क्रॉनिक रीनल फेलियर, क्रॉनिक रीनल डिजीज, रीनल फेलियर एंड स्टेज ऑफ रीनल डिजीज। मीन्स हमको ये सेम केयर प्लान तैयार करना है। तो यहाँ पर हमारा केयर प्लान है रिस्क फॉर डिक्रीज कार्डियक आउटपुट। इसके अंदर हम डिफरेंट नर्सिंग प्रोसेस स्टेप, नर्सिंग असेसमेंट, नर्सिंग डायग्नोसिस, गोल, नर्सिंग इंटरवेंशन, रेशनल एंड एवेल्यूशन, जो हमने यहाँ पर लास्ट में लिखा हुआ है को हम लर्न करेंगे। दिस इज एवेल्यूशन। तो ये हमारा फर्स्ट केयर प्लान होगा। यहाँ पर इसके अंदर जो भी हम स्टेप्स यूज़ करेंगे वो नर्सिंग प्रोसेस के स्टेप्स हैं और इस स्टेप्स के थ्रू ही हम यहाँ नर्सिंग केयर प्लान को कंप्लीट करेंगे। तो फर्स्ट देखते हैं रिस्क फॉर डिक्रीज कार्डियक आउटपुट, नर्सिंग असेसमेंट, सब्जेक्टिव डाटा नॉट एप्लीकेबल because this is the risk diagnosis here. Objective data here assess BP, heart rate and peripheral pulses. On the basis of these data we write here the nursing diagnosis. Here nursing diagnosis is risk for decreased cardiac output. Risk factor may include fluid imbalance affecting circulating volume, myocardial workload and systematic vascular resistance. Here goal होगा टू मेंटेन कार्डियक आउटपुट, नर्सिंग इंटरवेंशन रेशनल होगा। फर्स्ट इंटरवेंशन देखते हैं ऑस्कल्टेट हार्ट एंड लंग साउंड, एवेलुएट प्रेजेंस ऑफ पेरिफेरल एडिमा, वास्कुलर कंजेशन एंड रिपोर्ट्स ऑफ डिस्निया। रेशनल होगा S3 and S4 heart sound with muffled tone, tachycardia, irregular heart rate, tachypnea, dyspnea, crackle, wheeze, edema and jugular distension suggest heart failure. Next. Second intervention here assess presence and degree of hypertension, monitor BP. Significant hypertension can occur because of disturbance in the renin angiotensin aldosterone system caused by the renal dysfunction. Next, number third intervention, investigate reports of chest pain, noting location, radiation, CVT 0 to 10 scale and whether or not it is intensify by deep inspiration and supine position. Rational होगा although hypertension and chronic heart failure may cause MI, approximately half of chronic renal failure patients on dialysis develop pericarditis, potentiating risks of pericardial effusion and tamponade. Next, fourth intervention, evaluate heart sound, note friction rub, BP, peripheral pulses, capillary refill, vascular congestion, temperature and sensorium or mentation. Here, rational होगा presence of sudden hypotension, paradoxic pulse, narrow pulse pressure, diminished or absent peripheral pulse, marked jugular distension, pallor and a rapid mental deterioration indicate tamponade, which is a medical emergency. Number fifth intervention, assess activity level, response to activity. Here rational होगा weakness can be attributed to heart failure and anemia. Here sixth intervention होगा monitor laboratory and diagnostic studies. Here first, here electrolyte, potassium, sodium, calcium, magnesium, BUN and creatinine. Here rational होगा imbalance can alter electrical conduction and cardiac function. Next, chest X-ray. Here rational होगा useful in identifying developing cardiac failure of the soft tissue. Clarification. Number 7 intervention, administer anti-hypertensive drugs such as captopril. Here rational होगा reduces systemic vascular resistance and renin release to decrease myocardial workload and aid in prevention of the heart failure and myocardial infarction. Number 8 intervention होगा prepare for dialysis. Here rational होगा reduction of uremic toxins and correction of electrolyte imbalance and fluid overload may limit and prevent cardiac manifestations including hypertension and pericardial effusion. Number 9 intervention होगा assist with pericardiocentesis as indicated. rational होगा accumulation of fluid within pericardial sac can compromise cardiac filling and myocardial contractility, impairing cardiac output and potentiating risk of cardiac arrest. After writing these interventions, we write here the first nursing care plan evaluation. Here evaluation is maintained cardiac output. इस तरह से हम यहाँ फर्स्ट केयर प्लान को कंप्लीट करेंगे. तो नेक्स्ट देखते हैं सेकंड केयर प्लान. इसका डायग्नोसिस होगा अल्टर्ड रीनल टिश्यू परफ्यूजन. तो आइए देखते हैं इसके स्टेप्स. नर्सिंग असेसमेंट, डायग्नोसिस, गोल इंटरवेंशन, रेशनल. फर्स्ट, subjective data not applicable because this is the risk diagnosis. Objective data, here assess vital sign, monitoring laboratory studies, RBC, hemoglobin and hematocrit platelet. On the basis of these data, we write here the diagnosis. Here diagnosis risk for infective protection risk factor may include abnormal blood profile, suppressed erythropoietin production, secretion, decreased RBC production and survival. This is the diagnosis, and after this we write here the goal to decrease. Your goal is to decrease risk for ineffective protection. Here intervention and rational. Intervention number first, establish rapport. rational होगा to get the cooperation of the patient and significant others. नंबर सेकंड इंटरवेंशन देखते हैं, मॉनिटर एंड रिकॉर्ड वाइटल साइंस. या रेशनल होगा टू ऑब्टेन बेसलाइन डाटा. नेक्स्ट थर्ड इंटरवेंशन, असेस पेशेंट्स जर्नल कंडीशन. ये रेशनल होगा टू ऑब्टेन बेसलाइन डाटा. नंबर फोर्थ इंटरवेंशन, डिटरमाइन फैक्टर रिलेटेड टू इंडिविजुअल सिचुएशन एंड नोट सिचुएशन दैट कैन अफेक्ट ऑल बॉडी सिस्टम. रेशनल होगा टू असेस कॉजेटिव एंड कंट्रीब्यूटिंग फैक्टर. नंबर फिफ्थ इंटरवेंशन होगा नोट करेक्टरिस्टिक्स ऑफ यूरिन, मेजर यूरिन स्पेसिफिक ग्रेविटी. रेशनल होगा टू असेस फॉर इमेचूरिया एंड प्रोटीनूरिया एंड रीनल इम्पेयरमेंट. नंबर सिक्स्थ इंटरवेंशन होगा असर्टेन यूजुअल ब्रीडिंग पैटर्न. ये रेशनल होगा टू कंपेयर विद द करंट सिचुएशन. नंबर सेवंथ इंटरवेंशन, नोट प्रेजेंस, लोकेशन, इंटेंसिटी, ड्यूरेशन ऑफ पेन. रेशनल होगा यहाँ पर में इंडिकेट पेन on affected organ. Number 8 intervention, note mentation status and review lab results such as BUN, creatinine level. Here rational होगा increase BUN creatinine level may alter mentation. नंबर 9 इंटरवेंशन होगा मॉनिटर बीपी एज सर्टेन पेशेंट यूजुअल रेंज ईयर। रेशनल होगा जीएफआर में इंक्रीजेज रेनिन एंड रेज बीपी। नंबर 10 इंटरवेंशन ऑब्जर्व फॉर डिपेंडेंट जनरलाइज्ड एडिमा। रेशनल होगा टू नोट डिग्री ऑफ इम्पेयरमेंट ऑफ रीनल फंक्शन। Number 11 intervention measure urine output on a regular schedule and wait daily rational होगा to assess renal perfusion and function. Number 12 intervention provide diet restrictions as indicated. A rational होगा caloric to meet body need while restrictions of protein help limit BUN. Next 13 intervention होगा encourage discussion of feelings regarding of prognosis or long term effect of discussion. A rational होगा to decrease anxiety about the condition and correct his wrong ideas about the condition. Number 14 intervention identify necessary changes in lifestyle and assist client to incorporate disease management of activity of daily living. ADLS rational होगा to promote wellness and prevent further progression of the complex. Number 15 intervention here assess patient emotional psychological factors affecting the current situation. Rational होगा stress or depression may be increases the effect of an illness or depression might be a result of being forced into inactivity. After writing these interventions, we write here the evaluation of this care plan number second. तो यहाँ evaluation होगा decrease risk for ineffective protection. तो ये था second care plan. Next देखते हैं care plan number third impaired urinary elimination. Here same steps of nursing process here nursing assessment diagnosis goal intervention rational and evaluation we write here in last. Here nursing assessment subjective data here patient says that I am having less urination than previous days. Objective data here patient may manifest increase in lab results BUN creatinine uric acid level oliguria anuria hesitancy urinary retentions. After these observations, subjective and objective data, we write the diagnosis and diagnosis is impaired urinary elimination related to failing glomerular filtration. Goal होगा to maintain normal urine elimination. Intervention rational देखते हैं first intervention establish rapport rational होगा to get cooperation of the patient and significant other. Number second intervention here monitor and record vitals here rational होगा to obtain baseline data. Number third assess patient general condition here rational होगा to know what problem and intervention should be prioritized. Number 4 intervention review for laboratory test for changes in renal function here rational होगा to assess for contributing or causative factor. Number 5th intervention establish realistic activity goal with client here rational होगा enhance commitments to promoting optimal outcomes. Number 6 intervention determine client's pattern of elimination here rational होगा to assess degree of interferences. Number 7 intervention palpate bladder here rational होगा to assess retention. Number 8 intervention होगा investigate pain noting location rational होगा यहाँ पर to investigate extent of inferences. ये number 9 intervention determine client's usual daily fluid intake here rational होगा to help determine level of hydration. Number 10 intervention note condition of the skin and mucous membrane color of the urine rational होगा to assess level of hydration. Number 11 intervention होगा observe for sign of infection rational होगा to help treating urinary alterations. Number 12 intervention encourage to verbalize fear concern rational होगा यहाँ पर open expression allow client to deal with feelings and being problem solving. Number 13 intervention होगा emphasize the need to adhere with the prescribed diet rational होगा to prevent aggravation of disease condition. Next number 14 emphasize importance of having good hygiene here rational होगा to promote wellness. Number 15 emphasize importance of adhering to treatment regimen here rational होगा to promote wellness. After these interventions we write here the evaluation of this care plan here evaluation in maintained normal elimination pattern. Next देखते हैं next care plan number 4 ये डायग्नोसिस acute पेन, यहाँ भी हम सेम नर्सिंग प्रोसेस स्टेप जो केयर प्लान में हम यूज करते हैं, नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेशनल एवेल्यूएशन के थ्रू हम ये केयर प्लान पूरा करेंगे। तो फोर्थ केयर प्लान का असेसमेंट देखते हैं। नर्सिंग असेसमेंट, एयर सब्जेक्टिव डाटा, पेशेंट complaint about a pain on lower back between the pelvis and the ribs. Objective data, here patient may manifest facial grimaces, guarding behavior, diaphoresis, disturbed sleep. On the basis of these data, we write here the nursing diagnosis. Here nursing diagnosis is acute pain related to disease condition. Here goal is to patient will report relief and control of pain. Here nursing intervention, rational. First intervention here establish rapport here rational to guide the cooperation of the patient and significant others. Number second intervention here monitor and record vital sign here rational to obtain baseline data. Number third intervention assess patient general condition here rational is to obtain baseline data. Number fourth intervention assess patient description of pain here rational is pain is subjective experience and cannot be felt by other. Number fifth intervention perform a comprehensive assessment of pain, location, onset, characteristics and frequency rational होगा to be able to compare changes from previous reports to rule out worsening of underlying condition developing complications. Number 6 intervention होगा assess for referral pain as appropriate rational होगा to help determine possibilities of underlying condition or organ dysfunction requiring treatment. Number 7 intervention होगा explore method for alleviating control of pain rational होगा timely interventions is more likely to be successful in alleviating pain. Number 8 intervention होगा encourage verbalize of feeling about the pain rational होगा to allow outlet for emotions and enhance coping mechanism. Number 9 intervention provide quiet environment, calm activities and adequate rest, rest reinforce rational होगा to prevent fatigue and lesion stimuli. Number 10 intervention होगा provide comfort measures such as back rub, change position, use of heat and cold air. Rational होगा to provide non pharmacological pain management. Number next intervention here instruct and encourage use of relaxation exercise such as focused breathing. Here rational होगा this is form of relaxation technique that help decrease level of pain. Here number next intervention here this is the 11th intervention, this is 12 and continue here. 12 intervention here encourage diversional activities such as TV and socialization with other rational होगा provide diversional activities that help block the perception of pain by the brain. Here 12 intervention next 13 here assist the self-care activities here to able to perform activity daily living and maintain good hygiene. Number next intervention assist the treatment underlying disease process causing pain here rational होगा evaluate effectiveness of the therapy. Number next intervention provide for individualized physical therapy exercise program that can be continued by the client discharge referred to the physical therapist. Rational होगा to continue therapeutic effect and wellness for the patient. Next intervention होगा administer analgesics as ordered. Rational होगा pharmacological management of pain. After these interventions, we write the evaluation of this nursing care plan. Here evaluation is now pain is relieved and patient feel comfort. तो एक केयर प्लान कंप्लीट हो. नेक्स्ट देखते हैं नंबर 5 केयर प्लान. Here 5th care plan is risk for fluid volume. Here subjective data. Patient says that he is having breathing difficulty. Next objective data. Patient may manifest edema, hypertension, weight gain. After these interventions, we write here. After these assessment, subjective and objective data, we write the here nursing diagnosis. Here nursing diagnosis is fluid volume excess related to decreases glomerular filtration rate and sodium retention. Here goal is patient will manifest stabilize fluid volume. Here rational here intervention और rational देखते हैं. First intervention STL-based report rational होगा to gain patient trust and cooperation. Number second intervention, monitor and record vital sign, irrational होगा to assist precipitating and causative factors. Number third interventions, assess possible risk factor, rational होगा to obtain baseline data. Number fourth intervention, assess patient appetite, here note to presence of nausea and vomiting. Number fifth intervention, note amount rate of fluid intake from all sources, here rational होगा to prevent fluid overload and monitor intake and output. Number six intervention, compare current weight gain with admission of previous stated weight, air rational होगा to monitor fluid retention and evaluate degree of excess. Next, number seven intervention, skilled breath sound, air rational होगा for presence of crackle or congestion. Next, record occurrence of dyspnea, air rational होगा to evaluate degree of excess. Number next intervention, note 8, presence of edema, air rational होगा to determine fluid retention. Number 9 intervention, measure abdominal girth for change, air rational होगा may indicate increase in fluid retention. Number 10 intervention, evaluate mentation for confusion personality changes, air rational होगा may indicate cerebral edema. Number 11 intervention, air observe skin mucous membrane, rational होगा to evaluate degree of fluid access. Number 12 intervention, change position of the client timely, air rational होगा to prevent pressure ulcer. Number next intervention होगा यहाँ पर review lab data like BUN, creatinine, serum electrolyte, air rational होगा to monitor fluid and electrolyte imbalance. Number 14 intervention, restrict sodium and fluid intake if indicated, air rational होगा to lessen fluid retention and overload. Next 15 intervention होगा record intake and output accurately and calculate fluid volume balance, rational होगा to monitor kidney function and fluid retention. Number 16 intervention, weight client, irrational होगा weight gain indicate fluid retention or edema. Number 17 intervention होगा encourage quiet restful atmosphere, irrational होगा to conserve energy and lower tissue oxygen demand. Number 18 intervention, promote overall health measure, irrational होगा to promote wellness. After these interventions we write here the evaluation of this care plan. Now evaluation is now stabilize fluid volume. तो फ्रेंड्स ये थे हमारे नर्सिंग केयर प्लान्स फॉर क्रॉनिक रीनल फेलियर और एंड स्टेज ऑफ रीनल डिजीज़. तो देखते हैं एक बार फिर से यहाँ पर फर्स्ट केयर प्लान था ये पर रिस्क फॉर डिक्रीज कार्डियक आउटपुट. यहाँ से आप अपने नोट्स ले सकते हो, लिख सकते हो इनको. इंटरवेंशंस फोर्थ, फिफ्थ, सिक्स्थ, सेवन्थ, एट्थ, नाइन्थ. सेकंड केयर प्लान था अल्टर्ड रीनल टिश्यू परफ्यूजन. इंटरवेंशन फर्स्ट, सेकंड, थर्ड, फोर्थ, फिफ्थ, सिक्स्थ, सेवन्थ, एट्थ, नाइन्थ, टेंथ, 11th, 12th, 13, 14, 15th evaluation. Next third intervention, sorry थर्ड डायग्नोसिस. यहाँ पर नर्सिंग केयर प्लान है थर्ड का, आप यहाँ से नोट्स ले सकते हो. ये evaluation. नंबर फोर्थ केयर प्लान acute पेन. ये केयर प्लान नंबर फिफ्थ, रिस्क फॉर फ्लूइड वॉल्यूम एक्सेस. ये इसका एवोल्यूशन. तो फ्रेंड्स ये था आज का हमारा वीडियो नर्सिंग केयर प्लान ऑन क्रॉनिक रीनल फेलियर या क्रॉनिक किडनी डिजीज़ या एंड स्टेज ऑफ रीनल डिजीज़. तो फ्रेंड्स दिस इज़ वेरी इंपॉर्टेंट केयर प्लान फॉर एग्जामिनेशन पर्पज़ और फॉर द प्रैक्टिकल फाइल वर्क पर्पज़ एंड आल्सो फॉर द असाइनमेंट. तो फ्रेंड्स आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस वीडियो विद योर फ्रेंड्स एंड सब्सक्राइब माई यूट्यूब चैनल हियर Anand's nursing file preparation for the nursing competition examination. जिन्होंने अभी तक सब्सक्राइब नहीं किया, प्लीज़ सब्सक्राइब माई यूट्यूब चैनल एंड प्रेस बेल आइकन ऑल्सो। थैंक यू।